Got it. I'll just speak. I'm DeAndrea Levias with Total Accounting. I do business as Optimum Nonprofit Consulting. I currently am doing this technical assistance and capacity building work. I have a team and we have a current contract through BSK. I just love, I've come to know about and learn about a lot of community organizations that I didn't know existed. And just to be able to help and support them so that they continue to do the work that they're doing in the community is just really fulfilling. I do finance and HR capacity building. Then I have a team member that does marketing. And then another one that does equity, social and racial justice work. And I think we've had our contract a little over a year and a half now. And it's just been really great working with the different organizations.
Very cool. Thank you.
Yeah, I'll go next. I'll rather speak than writing. Okay. So I'm Ashina Ficharfus. I am from Dicentra Consulting. So Dicentra Consulting is a group of 3 colleagues established that agency. There is Suime and Karen. 3 of us have PhD in public health, epidemiology in particular. So we met 3 years ago while we were co-teaching a course at the University of Washington. Then, we are interested in research as well. So we said, hey, why don't we just establish a kind of a technical assistant and capacity building provider agencies and then work with community-based organizations. And we thought establishing this kind of agency will help us to kind of have a communication with at least the problems at the ground and then help us shape our research ideas. And since then, we have been providing technical assistance, and we started providing capacity building very recently. Yeah.
Very cool. Thank you.
Okay.
Trisha or Barbara in the chat, I'm assuming.
Yeah, I was still trying to come up with my answer. I'm Barbara Dawson from Strategy Works, and I just really enjoy the heck out of working with these small businesses and community-based organizations because they not always unique, but quite often unique challenges that unique to small businesses and to small CBOs. And I like working with them to resolve to resolve those challenges or figure out a plan. And they're just so eager to work and get to know everything. And I find that very refreshing. And, you know, it wasn't that long ago that we may have been in the same place. So I really like working with them. And I've met some amazing, amazing people. And I really enjoy that.
Thanks, Barbara.
Mm-hmm.
You want me to talk as well?
Sure, why not?
Okay.
Round us out.
Oh, Barbara and I have been working for years together, and I am going to just reiterate what everybody has said. We all are on the same page there. I am constantly amazed at the work, on the ground work that some of these organizations are pulling off with no funds. And they're making these huge differences in their own communities. And I cannot tell you how many times I was left speechless listening to the passion and listening to the workarounds and trying to figure out where their challenges are. And it has just been a thrill to walk people through this process. On the other end, on the beginning stages when we were working through this and getting the grants ready. And I'm an educator at heart. And hearing what the needs were that were from the simplest to the most complex to the very beginning to the very end of a process. And then the level is just so fun to figure out for me. It's like putting a puzzle together and really helping people find those puzzle pieces and putting them together and helping them become successful.
Awesome. Thank you.
You're welcome.
All right, thanks everyone. So we're going to get into a little bit of a presentation. We'll have time for questions and answers at the end, and we're kind of flip-flopping for between folks that are doing each of the slides. So we just wanted to flag that. Okay, so this project is funded by the King County Clifford dollars, and that's the COVID relief money that came out of the U.S. Department of Treasury. Our PSB grants team has been in partnership with OERSJ on many projects of this funding. King County as a whole got over 430 million, and we're just going through spending it between now and the end of 2024, with some exceptions into 25. And as I said before, this funding opportunity is in partnership between OERSJ and PSB. So you'll hear from each group throughout the time, but Phyllis is really your lead for anything program related. When it comes to billing, contracting, questions like that, you'll reach out to your PSB grants lead. In this case, that is Stephanie. But Stephanie, like I said, is out on parental leave. So in the meantime, it's me in partnership with some other folks on this team, including Will and Andrew and Amelia. Phyllis?
Okay. So our TACB RFA overview. It's technical assistance and capacity building. We were formerly CBOTA, community-based organization technical assistance. So all applications are due Wednesday, October 25th at 12 p.m. Funds available, $350,000 for up to 10 providers. And here is, the ways to apply. There's a link there. Eligibility, qualified service providers can be nonprofit organizations, community-based organizations, tribes and tribal organizations, businesses, public or governmental agencies serving communities in King County or private consultants. They must also have demonstrated experience working with organizations and expertise in a variety of grant-related areas. And just a reminder, no subcontracting is allowed under this RFA. So our focus areas are grant writing and grant budget development, accounting, application of 2 CFR 200, setting up internal controls, grant management, designing data collection methods, strategic planning, long-term budget development, governance structures, standard operating policies and procedures, staff structure, acquisition, subscription, implementation and deployment of technology solutions, CRM, project management software, accounting software. Okay. And here are our deliverables and with the, anticipated timeline.
And I think this might be Andrew's slide.
Andrew.
Sorry to cut you off.
Andrew, I'm sorry. I'm just going.
May I ask, are we gonna have, are you gonna email this deck to us? This presentation?
Yep.
Okay, awesome. Thank you.
Absolutely.
Going into the timeline, just to give a quick preview of our anticipated timeline. So again, applications are due 1 week from today on the 25th. And then we're hoping to have a quick turnaround on our evaluation and notify selected applicants by November 3rd. So that's roughly 10 days later. Then during the month of November, we'll do the work to get contracts in place and get them signed. And then hoping to kick off with services being delivered starting in December. The first activity or milestone would be for awarded consultants to meet with Phyllis and staff in the OERSJ office to review clients that are as they are assigned and discuss capacity level, make sure we've got everyone set up with an appropriate amount of clients to serve. And then the first due date is to complete a needs assessment, submit to OERSJ by March 1st. So we have from December to March a window of time to conduct a 1 to 2 hour initial intake meeting with each client and document a needs assessment to be submitted to OERSJ by March 1st. Then beyond that, contracts, the period of performance will last through 2024, ending no later than December 31st. We anticipate consultants to bill for services on a monthly basis. We'll have quarterly progress reports due at the end of each calendar quarter, detailing activities completed and services, as well as a final report 30 days after the end of the period of performance. One item to highlight here is that we've standardized our consultant hourly rate under this program. I want to give some context about that. So again, the underlying need is to provide support to organizations that are awarded grants under the $25 million Racism as a Public Health Crisis Grant Program. We had a previous RFP in 2022, and we kind of did a check and adjust to look at our lessons learned. We looked at the needs of our applicants and grantees and the services that were provided. And we identified a need to ensure pay equity, both for the consultants within our program providing similar services, but also for consistency across the greater King County departments. So we've decided to standardize our consultant rate at $175 per hour. This is consistent with the Department of Community and Human Services and their capacity building program. You know, our intent is to provide a consistent level of service that meets the needs of our program and our grantees. Couple housekeeping items for awarded consultants. Once award notifications go out, we have a vendor setup process for organizations that have not previously worked with King County. Part of the application, one of the questions is providing your tax ID that facilitates that vendor setup process. For those who have not worked with King County before, we have a form called a substitute W-9, as well as ACH payment setup for bank transfer of payments, and then a required registration in sam.gov for a UEI number.
All right. Thank you all. Will, do you want to go through questions and answers and start to read off? If folks want to put them in the chat or raise your hand. I'm going to actually stop screen sharing so I can access it. I know, Barbara, your question around recording and presentation materials, we'll send those out. If you all want to put your emails in the chat, that would be helpful.
So you do want us to just put our questions in chat, or
You can say them out loud.
Preferably in the chat, and then you
Right.
can say them out loud, because that way we can form an FAQ that is accessible to everyone. So if you put them in the chat, I can read them and then we can address them. Okay. The first question we have is how many contracts were awarded to small businesses and community-based organizations? That's a excellent question. So in small business, we have approximately 60 businesses that were given contracts, and we are anticipating that you will be serving 58 of those 60 businesses. So 58 of them we would consider small businesses. The other two are larger, more established. So for those two, we're not requiring that they receive technical assistance, but for the rest, other approximately 58, we are requiring that they receive technical assistance. In terms of CBOs, so we have, let me pull up that number. We will have 28 organizations in what we call our capacity building grant that we won for them to receive technical assistance. So 28 in capacity building, about 58 in small business. So that's a total of can someone do the math for me? 60 plus 28, 86 minus 2, 84.
Nice.
84 approximately. That may change slightly because there were some that were like disqualify and some that were extending an award to. And so that number could change slightly. The next question is time with us mandatory in their contract? Another excellent question. And the answer to that is yes. We made it, we included language in their contract regarding technical assistance. And let me see if I can pull up the exact language. So we incorporated that into their scope of work, and that's one of the milestones. So in the scope of work for the ones that would be receiving technical assistance, we said that they would develop a needs assessment with the provider. But that's the entirety of the language. So it doesn't say, how many hours. It doesn't contain specifics around what that needs to look like. It just says that they need to meet with a provider to develop a needs assessment.
Is there a
Yes.
time limit to that?
Another good question. So ideally, we want them to set up the meeting with you by January 15th of 2024.
Mhm.
But like it's stated in this contract, the needs assessment doesn't have to be submitted until March 1st. Is it, Allison, on the slide? March 1st of 2024.
Confirmed, yep.
Mm-hmm. The other question is, how will we delegate clients to vendors?
Clients to providers, I guess is what I should have said.
Yeah, how will we delegate clients to providers? So that will depend on who we end up contracting with. It depends on the number of providers that we have. It also depends on just type of technical assistance that you'll be able to provide. So as mentioned earlier, we have about 58 small businesses and about 28 community-based organizations or small nonprofits. So we need providers that can assist that many small businesses and that many CBOs or small nonprofits. But we haven't determined exactly how we will delegate it. We're hoping to first find out how many we would contract with, their capacity, the levels of service that they can offer, and then we can make that determination on how to delegate those numbers. We definitely don't want to overwhelm you with clients. So we're hoping that in your proposal, you state the level of like clients that you can take on from our CVOTA program. We heard about some of that level. And so, but if there is a provider that can take on a significant amount and they are like, yeah, that's fine, then we would take that into consideration in order to assign you a certain number. But again, I think we would work closely with you in order to determine what that figure might be. The next question is, what criteria are you looking for in TACB providers? How would you allocate 350,000 to agencies? And then the question after that is there a minimum and maximum budget you would provide for an agency? Allison or Phyllis, is there criteria that we're specifically looking for besides so I know we have a slide where we mentioned potential services that we might be looking for. Is there a specific criteria?
Yeah, so I think you'd want to be able to speak to that in your application materials, just your ability to demonstrate experience that you have providing this type of service to either community-based organizations, small businesses, or both. I don't know that we have a specific criteria other than you show that you've done the work before, you are an agency that folks can trust and come to, and you're approachable. And then some of the questions get at to what type of experience you have with diverse populations, and potentially populations that you don't have the background in. So I don't know if that helps answer it at all.
I would also direct folks to page 12 of the request for applications to the evaluation criteria that talks about how we will assess responses to the application questions as they come in.
Great, thanks.
Thank you, Andrew. I will also share that the $25 million grant to address racism as a public health crisis. The majority of CBOs, nonprofits, and small businesses, they represent organizations and small businesses that are serving the Black and Indigenous population. And in terms of specifics, like types of technical assistance that we hope they would receive, there is nothing specific that we inputted in their contract. So, and also that might vary. So there is, the small businesses represent several industries, and also the nonprofits or CBOs, they also, they covered various sectors. So from healthcare to mental health, to other social services. And so there is not a specific type of technical assistance that we're looking for them. Just to clarify that. And in terms of the next question, how will we allocate $350,000 to agencies? Allison, I would assume that that would also depend on the proposals that we get. So again, we only have 350,000 available in order to serve approximately, like I said, less than 60 small businesses and 28 CBOs or small nonprofits. And so we have to determine, based on the amount of proposals and what's in the proposals, how we would allocate that. So if we get 10 proposals and 5 of them can serve those numbers, and then we also would analyze their proposal, and they score well, then those are the things that we would have to take into consideration. We might end up with 10, we might end up with 2 or 3. It varies. It depends on who applies, the proposals that we see, but we just have to make sure that we can serve about 60 small businesses and 28 CBOs or nonprofits with the 350,000 that we have available. Is there a minimum and maximum budget you would provide for an agency? As far as I know, Andrew or Allison, there is no minimum, and the maximum is 350,000. Next question is the 1 to 2 hour initial meeting billable? Allison and Andrew, you can correct me if I'm wrong, but we discussed that that is definitely billable for the 175 hour rate, right? Okay, yeah. As a consultant company, if we need to, we hired additional consultants, would you consider that subcontracting?
Nope,
No.
that should be
Okay.
fine.
That'd
What
be
we're
fine.
trying to get away from is folks who are a not technical assistance provider, so like an organization who then hires technical assistance providers to do the work. We want a direct line
Mhm.
between the providers and King County.
Okay, great, thank you.
Thank you for clarifying that, Allison. And the last question that we have is, will providers be assigned clients? We provided TACB on the racism as a public health crisis.
Like, I know that there was several of my clients that I worked with that applied for this, and they are awarded contracts, and so when they let me know, I mean, they just, given the opportunity, they would like to continue to work with me. We've established a relationship. I told them I really didn't know how that was gonna happen.
We haven't determined that. You know, if you are to be contracted, I'm assume that we can definitely take that into consideration. That would make a lot of sense to me personally, if you already have rapport with the client.
Mhm.
Yeah, we would have to discuss it internally within King County staff.
Thank you.
Any other questions?
All I can think of right now, but I know there'll be more that will pop up.
If they do, maybe Phyllis, you could put your email in the chat.
Oh, I
Yeah.
have Phyllis's email.
Well, for other folks too. You have all of our emails probably. Yeah. So we will with the recording, also with the PowerPoint. I wrote down the questions so that we'll have those and the answers, and we can send those out too, probably.
When do you think we'll have those?
As soon as Phyllis hit send on with the recording.
Okay. And then the presentation,
We'll put them all together.
same thing?
Sorry, Phyllis, you're on mute. I just keep talking for you.
Okay, I can get that to you today. If we get the recording and the PowerPoint.
Awesome, thank you.
Did
We're just-
everyone put their email address in the chat?
I did.
Yeah, I did.
Okay, good.
Might need Trisha's if she wants.
Trisha,
Yes.
is Trisha here? I'll just go ahead and add it.
Okay.
Thank you.